Is it on? Hey guys, if you're watching this, you're a recent nursing graduate, you're studying for your NCLEX, or you're just genuinely interested in what the NCLEX is. I am here to tell you how I passed my NCLEX in 75 questions, and so can you. I cannot disclose what is on the NCLEX because it is completely different for every individual. The NCLEX is a computerized adaptive test. So you can get 75 questions and pass or fail, or the maximum number of questions you can receive is 265 questions. Now, I wasn't getting to 265. I told myself I want to go into this NCLEX and I want to take my NCLEX in 75 questions. I don't want to be sitting there for the whole time. So I bought the 90-day UWorld subscription that came with 2 practice tests, 2,100 questions to test your ability on how to prioritize, how to delegate, just in terms of content, in management, in safety control, and infection control, and how you are going to deal with different situations as a nurse. The NCLEX wants to know that you are going to be safe. You are going to advocate for your patients, and you are going to provide safe, competent, and therapeutic care. I started studying April 25th. I graduated from nursing school on May 13th. I got my authorization to test on June 3rd, and I took my NCLEX on June 17th. I did 75, anywhere between 75 and 150 questions each day. Very important that you understand the rationale in why a question is right and also why a question is wrong. You don't want to get to your NCLEX and leave anything to chance. It would remediate for 3 to 4 hours, and I would do that. I would, you know, take a screenshot, drag and drop, and um, make a study guide so I could look it over the next morning and go into it fairly confident, trying to answer those wrong questions. Read the question not once, not twice, 3 times. First time as a general way to understand the question, well, what is this question asking me? The second time, is this a prioritization question? Is this a delegation question? Is this a question asking me to look for the right answer or the wrong answer? What Pay attention to the wording. And then the third reason you want to reread the question overall is to rephrase it. Before taking your NCLEX, go to your testing site, know where your testing site is. For me personally, I was familiar with the area in which I was testing. I stayed at a hotel right around the corner. I want to say only 10 minutes away from the testing center. And that was most beneficial for me because I like to get up early. It takes me a little bit to wake up. I wanted to have my coffee. I wanted to go over my lab values, and I just wanted to be there bright and early so I could be the first person in to take my NCLEX and the first one out. Get a good night's rest. I know everybody says this. For me personally, when I was in nursing school, if I didn't sleep, I just knew the next day would be really hard. Have a nice hearty meal the night before. You don't need to be rolling into the NCLEX on an empty stomach. Same goes for breakfast the morning of. You want to have something solid and something that will help keep your mind occupied on the exam and not on your stomach. I did a lot of research on the NCLEX in general. I studied a lot for the NCLEX, but I also studied the NCLEX. Don't do the Pearson VUE trick. I know a lot of people say, oh, it's very accurate. For me, it didn't work, and I passed in 75 questions. The 48 hours after your NCLEX, it is the longest waiting time. My biggest suggestion is go on a trip, busy yourself for 48 hours, and then pay the quick result. You don't need to be waiting around. Your mind doesn't need to go down a rabbit hole. Okay? You're studying the whole time you're in nursing school. It's not The NCLEX, I feel like people build it up to be this horrible situation if you don't pass. You will pass your NCLEX. You pass nursing school, you've studied, you get good grades, and even if you are not the best student, but you have a lot of grit, you will pass your nursing licensure exam. You will, and you'll become a registered nurse, and you'll look back and say, wow, why did I have so much anxiety? Feel free to like and subscribe because I will be bringing more videos your way.